Hello everyone, a very good afternoon to all of you. So today let's talk about mucogingival surgery. Okay, so this session will be about the very basic terminologies which you should get accustomed, because whenever I talk about those terminologies, you should know actually what is the basics of the certain terms, so that you can very easily you can understand the surgical procedures. Okay, so the first terminology what we are going to learn in this session is the width of attached gingiva. Okay, most confusing, right? You get a lot of schools of thoughts from a lot of people, a lot of professors, a lot of staffs will give you a lot of inputs. Okay, add my input too. So let us imagine a tooth. Okay, so this is the junctional epithelium, and then below the junctional epithelium is the gingival connective tissue fibers, and below the connective tissue fibers will be the periodontal ligament fibers, PDL. So this is the basic structure, and this is the alveolar bone. So what happens, what is width of attached gingiva is the portion of gingiva that is firmly attached to the periosteum of the alveolar bone. What do you mean by periosteum? Periosteum is the outer covering of the alveolar bone. So it is rich in blood supply. So the part of gingiva which is attached to the periosteum of the alveolar bone is the width of attached gingiva. What is the significance? As I tell you, the width of attached gingiva. So imagine if there is no attached gingiva, only if you have gingiva which is movable, whatever we eat is going to go into the sulcus, it is going to form debris formation, plaque formation, and that is going to result in periodontitis, right? So the width of attached gingiva, the main significance is it prevents the food or plaque formation or plaque accumulation. And also, as I told you, gingiva is rich in collagen fibers, type 1 and type 3 predominantly. So the width of attached gingiva will have more amount of collagen fibers. In that way, it resists inflammation. How? The dense collagen fibers, if you see, it will not allow the bacteria to penetrate inside that much. So the dense collagen fibers prevent or resist inflammation, which is present in width of attached gingiva. Okay, so two main reasons why we need width of attached gingiva. One is to prevent the plaque formation or accumulation. Another one is it definitely fights against inflammation. Okay, now how to measure it? Very simple way. Okay, see, I'm going to measure it externally. Externally means outside, and also I'm going to measure it internally. Okay, externally I'm going to place a probe. Okay, so I'm going to place a probe just over the gums. Okay, I'm going to place the probe over the gums, and I'm going to measure the distance from, this is gingival margin, right? The distance from the gingival margin to the mucogingival junction. Okay, see, you take a look at this image. This is the gingival margin, right? So you see a clear demarcation, right? I'll just erase it, and then again I will draw it. Okay, so you see a clear demarcation. This is the mucogingival junction. Okay, what is a mucogingival junction? It is a demarcation between the alveolar mucosa, this is the alveolar mucosa, and the attached gingival portion. Okay, so now how we are going to measure it is, I will keep a probe from the gingival margin to the mucogingival junction. I'm inserting the probe into the sorry, I'm not inserting the probe, I'm measuring it externally. So I'm measuring the gingiva from the gingival margin to the mucogingival junction. So I'm keeping the value as A. The next step what I will do is, I will insert the probe into the sulcus and I will measure the probing depth. I'm going to keep that value as B. So say for example, A is 7 mm and B is 2 mm. The width of attached gingiva will be 7 minus 2, which is 5 mm. Now, I'm going to frame it in words. What is width of attached gingiva? The distance from the free gingival margin to the mucogingival junction minus the probing depth. Right? So, why? Because probing depth is the sulcus or the gingival sulcus which is unattached. Right? So, I'm inserting the probe. Obviously, the probe will enter only when there is space. So the probe will stop when there is no space or when the resistance is felt. That is where the attached gingiva begins. Because I am inserting the probe into the sulcus or inside the gingiva, I cannot visualize it externally, right? So for that, what I am doing some external measurement. That is, I am keeping the probe from the gingival margin to the mucogingival junction, and I am subtracting it with the gingival sulcus. So in this case, let us assuming that it is the distance from the gingival margin to the mucogingival junction is 7 mm and the probing depth is 2 mm. So the width of attached gingiva is 5 mm for this patient. Okay, now what is the normal values of width of attached gingiva? Very important. Maxillary anteriors, it is 3.5 to 4.5 mm. Mandibular anteriors, 3.3 to 3.9 mm. Maxillary premolars, 1.9 mm. And mandibular premolar, 1.8 mm. Very important values. So the first terminology what we saw today is width of attached gingiva. The portion of the gingiva that is firmly attached to the bone. To be specific, periosteum of the alveolar bone. Why it remains attached? Because it has to prevent the plaque accumulation and it resists against inflammation. How to measure it? Very simple. The distance from the free gingival margin to the mucogingival junction minus the probing depth. That's it. Okay, so these are all the normal values. So the first terminology which you should get accustomed is width of attached gingiva. Okay, now how to examine or how to evaluate the width of attached gingiva? One is what I told you, it is the mechanical method, which is the probing depth measurement. There are other ways to measure the width of attached gingiva. Okay, so the next one will be LA test. So when I give a local anesthesia, okay, we all would have seen that when we give infiltration, especially in the upper regions, it will become swollen, right? The area of the injection site will be swollen, right? Why? Because the alveolar mucosa is rich in elastic fibers, so that area will swell up. Whereas the attached gingiva portion will blanch. Why? Because there's dense collagen fibers. So the area of blanching and the area of swelling, right? So that determines the width of attached gingiva. So next one is LA test. Swollen areas, alveolar mucosa, blanching areas, width of attached gingiva. The next test will be roll test. So I'm keeping a blunt instrument and I'm running through the from the alveolar mucosa coronally towards the attached gingiva. The point where the instrument stops rotating is the apical portion of the width of attached gingiva. Okay, roll method. The next one will be Lugol's iodine test. So the alveolar mucosa, it will be rich in glycogen content. So it will take up the stain, whereas the attached gingiva will not take up the stain. Lugol's iodine test. Okay, so till now we saw mechanical, LA, roll test and Lugol's iodine test. There is also another method called ultrasonic probes. So that is advanced method where we use a probe to measure the width of attached gingiva. Okay, now these are all the ways how you can measure the width of attached gingiva. So the first terminology is simple and clear, right? So width of attached gingiva. The second terminology what we are going to learn is gingival recession. What is gingival recession? Gingival recession is the apical migration of the gingival margin below the level of CJ. So, see, doesn't deal about the it doesn't deal or it doesn't have any relation with the width of attached gingiva. Okay. So normally the marginal gingiva will be like this. Okay. In case of a recession patient, the marginal gingiva will be like this. So what is this? Apical migration of gingival margin below the level of CG. Every word is important. Okay, so the apical migration of the gingival margin below the CEJ is recession. Apical migration of junctional epithelium is pocket. Okay, so you should differentiate among this. there are Miller's classification. You would have heard of it. Class 1, class 2, class 3, class 4. Class 1, interdental bone loss will not be present. The marginal tissue recession will not extend to the mucogingival junction. Class 2, interdental bone loss will not be present. The marginal tissue recession will extend or will not extend to the mucogingival junction. Class 3, marginal tissue recession will extend beyond the mucogingival junction, and also there will be mild interdental bone loss. You can expect partial root coverage. Class 4, severe interdental bone loss. So root coverage is contraindicated in these patients. And class 1 and class 2, 100% root coverage is possible. Basic classification of gingival recession, which everybody should know. Miller's classification. Class 1, class 2, class 3, class 4. Recent classification. Cairo et al. He classified it. So RT1, RT2, RT3. So RT1 will corresponds to Miller's class 1 and class 2. RT2 corresponds Miller's class 3. RT3 corresponds Miller's class 4. What is RT1 is there's going to be no interproximal attachment loss. Okay, there is no interproximal attachment loss. RT2 is there is interproximal attachment loss, but it is less than the buccal attachment loss. See, this is interproximal attachment and this is buccal attachment loss. Okay, so what we see you are seeing me this view, right? This is the buccal and the area between the tooth is interdental. We all would have known, right? So similarly, RT2 is the interproximal attachment loss will be there, but it is less than the buccal attachment loss. And RT3 is the interproximal attachment loss is more than the buccal attachment loss. Okay, this is the recent classification, Cairo et al. Classification of gingival recession, which everybody should know. Okay, now moving on to the next terminology, pedicle graft. Okay, so pedicle graft and free graft, very, very, very important as far as the mucogingival surgeries are concerned. What do you mean by a pedicle graft is very simple. If I cut a piece of tissue and I'm placing it in another area, say for example, I'm cutting this piece of my skin and I'm placing it in my cheeks, that becomes a free graft. It is free, right? So it can move from ear to ear or wherever I want. So it is a free graft. But if I cut this tissue, okay, if I cut this tissue and I'm just moving it without completely detaching the tissue, that is called as pedicle graft. So pedicle graft is a stem or a tube of tissue remain attached to the donor site. Okay, so what that means, I'm not completely removing the piece of tissue, I am just slicing the tissue so that some portion of the tissue remains attached, and I'm stretching the tissue and I'm replacing it adjacent sites. Coronally advanced flap, apically positioned flap, laterally positioned flap, transpositional flap, double papilla flap, all bridge flap, all these kind of flaps are pedicle graft. What do you mean by pedicle graft? I'm not detaching the soft tissue completely, giving a slice, giving an incision, stretching it to adjacent, up, down, lateral, or whatever it may be. So the stem or a tube of donor tissue remains attached. Okay, now what is a free graft? Exactly opposite to it. So the graft or the piece of tissue is completely detached from the donor side. Example, excellent, connective tissue graft and free gingival graft, right? So if you understand these two terminologies, it will be a cakewalk for you when you talk about classification of mucogingival surgeries. Okay, so pedicle graft, stem of tissues, tube of tissue remains attached coronally, laterally, apically, bridge, transpositional. Okay, so free graft, connective tissue graft and free gingival graft. Okay, so this is another very important terminology which you should know. Okay, now the next important terminology which you should know as far as the mucogingival surgery is concerned is the biological width. Okay, so biological width is basically the combination of junctional epithelium plus gingival connective tissue fibers. Okay, so it is a combination of junctional epithelium plus gingival connective tissue fibers. So it is approximately 2.04 mm. Okay, 0.97, 1.07. So it is approximately 2.04 mm. So this is the the biological width, or it has been replaced by a new term called supracrustal tissue attachment, whatever you call it. Okay, so now we have come to end of the basic terminology sessions. We talked about what is width of attached gingiva, how it is measured, and what are the normal values of width of attached gingiva. We talked about recession, Miller's recession, Cairo et al recession. We talked about what is pedicle graft, what is a free graft, and also we talked about biological width. So once you know, or once you are accustomed with these basic terminologies, it will be very cakewalk for you to understand the further surgical procedures which are involved in the mucosal surgeries. So in the upcoming videos, I will be talking about the surgical procedures involved in the mucosal surgeries and what are the procedures we do or we perform in the mucosal surgeries aspect. So thank you so much. Have a nice day.